Welcome on this great Friday afternoon. Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best, regardless of age, injuries, or medical conditions. Yes, it's that time to Jamie. It's good to see you. I will answer your question in just a second. Sorry, I haven't had a chance to read it, but I will. This is your time to ask me questions, whether it's health, wellness, peptides, exosomes, all that kind of stuff that people seem to like to email me about, or if you want to ask an orthopedic question, injuries, surgeries, recoveries, that kind of thing, like Jamie's doing, please do that. Also, I would love to know where you are on this great Friday afternoon, or if it's Friday night, depending on what part of the world you're in, or Friday morning, depending on what part of the world you're in. I would love to know that as well as where you are located. Please remember, this is not meant and will not be considered medical advice. I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, any of that. So this is meant for general information and educational purposes only, but this is the only time I do it. I don't answer questions in response to emails or comments on YouTube or really any of that. This is the one time a week I do answer questions, so feel free to ask away. Just know it's not medical advice, but you can take that information to your doctor to make the decision that is best for you. Georgia, it is good to see you. I did have a good rest. It was very nice. Memorial Day weekend. It was very, very much needed, and even a little bit into the beginning of the week. All right, back to Jamie's question. Is there something I can do differently besides cortisone shots in my shoulders? I'm in a lot of pain and stiff. And again, I know a little of this. Jamie has asked questions before, so I know she's had a problem that goes on for a long time. I've said in response to a ton of different questions over the years, one thing about stiffness is that it's better to prevent it than to treat it. Once a joint like the knee, like the shoulder gets stiff, it can be really hard to get normal motion back. Still a huge fan of physical therapy. Sometimes to get range of motion back in the shoulder, though, you need to do a procedure, whether that's a manipulation under anesthesia, where the anesthesia folks sort of make you sleepy and then the surgeon sort of cranks on your shoulder and breaks up scar tissue to get the motion back. It sounds barbaric, and honestly, it kind of is, but that can be done. Sometimes you go in surgically and clean out scar tissue. You can also release the capsule to increase the range of motion. As far as cortisone shots go, I don't really know kind of a polite way to say this. I've never been a big fan of cortisone shots. I'm one of the few orthopedic surgeons that thinks they're really horrendous. I think there are some occasions that I will use it as sort of a one-time thing. In my opinion, and a lot of scientific evidence, scientific research shows that they have more long-term harm than short-term benefit, especially into joints, breaking down the articular cartilage in the case of the shoulder, weakening the rotator cuff tendons and muscles, making them more likely to tear and making the repair less likely to work. So I'm not real big on cortisone. As far as alternatives to cortisone, it really depends on what the problem is. And so that one's a little, it's hard. You could go a lot of different directions with that. I'm just not for instance, you could do, depending on what the problem is, platelet-rich plasma, peptide injections, exosomes, and then, like I said, non-injection type of things, medications, like I said, potentially peptides, physical therapy, surgery. It just depends really on kind of what the issues are. And you are so welcome for that. All right, CD Harfail says, I had a fracture in my leg, broke my tibia, got a rod inserted. That is Not the world's best thing short term, but those have good long-term outcomes. Assuming that the bone lined up well and healed, that typically does very well. Most people do not need to have them removed. They're buried down the center of the bone. But sometimes the screws that lock the rod in place and keep it from rotating within the bone, sometimes those screws can irritate you either close to the knee or close to the ankle, and sometimes you'll go in and take that out. But very rarely do you have to take the nail out unless it just either doesn't heal or it gets infected for some reason. Jamie says, yeah, went to PT, then moved. That's kind of a really tricky thing when you can't do physical therapy. That was something like that was a very common refrain during COVID, where people had surgery before the lockdowns, had started physical therapy, and then all of a sudden couldn't go to physical therapy. They were trying to work with their physical therapist sort of online by Zoom, and they didn't do that well. I have seen a lot of sort of long-term second opinions, people many years out from their problem, and that was part of what had happened. Anyway, CD finishing the question, will I ever be able to remove those after a few years? Not happy to have hardware in my body. It gets back to what I said. You could remove it. The problem with removing a nail is where you put it in close to the knee tends to fill over with bone, and it is a monster surgery to take one of those out. In my experience, if it's not causing any problems, going in and taking it out sometimes causes more problems than it solves. Now, it can be done. There's no question. Like I said, we take them out for if they get infected or if it never healed, even with the bone in place. But even that is not easy in that circumstance. One that has well healed, typically not an issue. But if it's a personal thing, I'll be curious if you find people surgeons that want to do that. But I'm sure somebody probably could. But usually you take it out, didn't heal, got infected, or if those screws are painful, somebody will take it out for that reason. All right. Knighton or Natine, I apologize, I don't know how to say that. PCL avulsion fracture surgery, February 23rd. And just about 3 months later, fracture's healed, when to resume sports. This is not medical advice, so I'm not able to tell you that you can resume sports. That will be for you and your doctor. Having said that, and I've said this about a lot of different injuries, the amount of time is only one of many factors, and it's probably the least important factor in terms of when somebody can go back to sports, whether that's after an ACL surgery, PCL avulsion fracture, shoulder dislocation. The amount of time from injury at best is just an average of when people go back. There's not an absolute, like day 20, let's just say it's 30 days till you get back to sports. Day 29, you're not allowed to. Day 30, all of a sudden it's magically low risk. No, that's not how it works. Typically, you need to have full motion. You need to have full strength of the muscles around the knee. Then you need to be able to do sport-specific activities. And it's one reason I'm a big, big fan of physical therapy, because the physical therapist can put you through exercises and maneuvers and things that recreate that motion and see if you're ready to do those moves on a field or on a court, or if you have abnormal landing mechanics or some sort of compensatory behavior that has to be fixed. So that's what it really comes down to. And then you slowly work yourself back in. Sometimes it's just walking, then jogging, then you lightly try to do the activities, not in a practice, but just on your own. Then you go to practice, then you go to play, something like that. On average, and again, I told you the time does not matter. With a PCL avulsion fracture, it's somewhere between 3 and 6 months. Full PCL reconstruction, where you make a new PCL, that's the big thick ligament behind the ACL, you're talking 6 to 9 months minimum, probably for high-level athletes, more like 9 to 12 months. PCL avulsion, where you pull off a little piece of bone, but the ligament's okay, so you reattach the bone with a screw or a screw and washer. It's probably going to be a little bit faster. Like I said, 3 to 6 months, maybe as early as 3 to 4. But again, the time is not what determines when somebody can go back to sports. Alrighty, let's see. Bina, shoulder arthroscopy, February of 2022. Shoulder is still severely hurting. Biceps tenotomy. Let me see if I didn't see where there was any more question to that. And CD, you're very welcome. I hope that was helpful. The shoulder arthroscopy, biceps, was that tenotomy? I don't remember. Yeah, biceps tenotomy. So your bicep, big muscle in the arm, attaches to a tendon that runs right up the front of your shoulder, attaches at the top and front where the superior labrum, the labrum's the cartilage bumper along the socket, the biceps attaches to that. Without being involved here, biceps tenotomy is either because it was frayed and somebody was having biceps tendonitis, essentially, or biceps tendon fraying up at the shoulder, or occasionally it would be due to a chronic superior labral tear, and you're just basically decreasing pull on it to get rid of the symptoms. Typically, though, with a labral tear, if you're going to do not the labrum but the biceps, you're going to do a tenotomy, and then you're going to reattach it to the top of the proximal humerus, kind of right in here, what's called a biceps tenodesis. As far as pain after that, I think it really depends on what the circumstances are. Does somebody have full motion back? Do they have full strength back? Again, both of those important with therapy. Was there any other pathology going on? Cartilage damage, rotator cuff pathology, labral pathology, things like that. Those are all things that you kind of have to look at. So in your case, I can't really tell you that for sure. Hewer Chelsea. ACL surgery 3 years ago. Past 6 months, I've had knee pain when I extend my knee. Feels like something in my knee stops me. Comes every week or two. Yeah, it's hard, and some of it with an ACL depends on what graft was used. If you use the patella tendon graft, that typically has a higher rate of what we call anterior knee pain under the kneecap. Hamstring doesn't have that as much, but I'm not so big on hamstrings for females, certainly fine for guys. And I know people get away with doing it in females some, but females are very quad dominant, weak hamstrings. So if you take one of the hamstring tendons, you typically make that worse. And I've seen a number of females that I saw as second opinion that had hamstring ACLs that all of a sudden their knee hyperextended when it didn't before and the other side doesn't, which becomes kind of a problem. Having said that, patellar tendon graft, a little bit higher incidence of anterior knee pain, but it also sometimes can just be from not getting the quad strength back, the hip flexor strength back after surgery. And so sometimes, in fact, where I would typically start with a patient that I came in and was having anterior knee pain, years after an ACL, let's get back into physical therapy. Let's get that quad strength back, VMO strength back, hip flexor strength back, and see if the symptoms go away. If they do, fantastic, you're done. If they don't, then maybe you look for other reasons, getting an MRI of the knee if that's possible depending on the hardware, and looking for cartilage damage under the kneecap, or what we used to call chondromalacia, but some explanation of patellofemoral pain or patellofemoral arthritis. Is there something else in the knee that potentially would be causing pain? Typically not when it's in the front of the knee, especially if it's going up and down stairs, sitting with your knee bent for a long period of time, movie theaters, buses, airplanes, cars, in class, auditoriums, that kind of thing. Those are kind of the things I would kind of think about. And Shitra has another question. Fractured leg ever be the same strength as before doing PT, a lot of limping? 3 months after surgery? Yes, typically. 3 months, I don't know if that tells me all that much, because they typically take 4 months at least for that bone to be as fully solid. So I don't know that that's surprising, but yeah, typically the goal, the bone gets back to full strength, and if you work really hard on it, the muscle gets back to full strength. But let me tell you, the calf muscle strength around a broken leg where they put a tibial rod in, it takes a long time for that to come back normal. It may be a year before the muscle is the same size as the other side, if not longer. That's something you have to work really hard on, not just physical therapy, but just on your own. All right, that looks like all I am seeing. I'll stay for another couple minutes. If you want to see me as a patient, if you want to see an orthopedic surgeon that can talk to you about all your options, not just surgery, cortisone shots, physical therapy, even though those are a lot of what I talked about here, and you want to talk about some other options, all your options, I'd love to help. I'm a double board certified orthopedic surgeon, hoping to be triple board certified here in the next couple months. You can come see me in Charleston. The link to my website is in the description below, drdavidgeier.com. Go to the Work With Me page. There'll be a contact thing. Just fill that out. It gets to me and my assistant, and we can help set that up, or we could find out some other way to work with you if you can't get here. All right, last couple questions, and then I am going to call it a day. Jake says, 7 weeks post meniscus repair. Whenever I sleep, rotate my knee to lie on my side, feel something twinge in the medial side of the knee. That could be normal. Meniscal repairs tend to take a while. That's where you have a meniscus tear and you're sewing it back together with stitches, and that can take a while to heal, 3 or 4 months. So if you twist on it and it's not done healing, yes, you may still feel that. It could be abnormal, I can't really say, but that isn't necessarily something I personally would get worked up if one of my patients said that. If it persisted 6 months, 9 months later, maybe that's something more of a concern. All right, that is all I've got for you. Next week, I am back for Better Than Ever Live, Tuesday and Thursday afternoon, 5 p.m. Eastern Time. A lot of good topics we're going to discuss. Be back here next Friday. If you have more questions about your injury, or if you have friends, definitely tell them about this. Friends with orthopedic injuries, health and wellness questions, Tuesday, Thursday, 5 p.m. Eastern Time, Friday at noon Eastern Time. Jake, you are so welcome. Everybody, thank you so much. Have a fantastic weekend wherever you are. Again, I hope you make this weekend your masterpiece, and I will see you right back here next week. Take care.